Welcome to CrackTalk.
Hey everybody, how you doing? Back to CrackTalk this week. Dr. J here, and I got my boy Scott. How we doing?
We're doing good, Jay.
Awesome. And we have a doozy for you today. We are going to be talking about degenerative joint disease, or DJD, or degenerative disc disease. I even get it messed up, DDD. And just so everybody knows, it's not a death sentence. So Scott, we want to remind everybody before we go into this to, if you like the content,
like it, subscribe to this channel. That way you're alerted every time that we upload a new video with content. Please share it. If you guys are liking the content that we're putting out and you know somebody, yourself or a loved one, friend, family member that could use this information, please share it.
Please share it. Because there's no use in getting information, and if it doesn't apply to you, cool. You're cool as a cucumber. Right. But if you don't share it, it's like not knowing it. And we are doing this specifically to help people get out of pain, get back to life so they can start doing the things they love to do. Then, I just always like to say, first we're going to educate you. Next thing I just want to get everybody on this phone fired up in this podcast that you don't have to live with some of these conditions that people say, oh, I've just totally got to live with it. No, you don't.
And that's so unacceptable, Jay. And that is something, in sharing this, is our goal is to educate people about chiropractic and the things that we don't think about. So we've said it in a few podcasts. We think about chiropractic, everybody goes straight to, oh, that's neck pain, shoulder pain, back pain.
Low back pain. That's it.
That's it. That's all they do.
That's it.
And the whole goal of this is to just enlighten people and educate that it goes so far beyond that.
Man. Yeah. And, so we do this. We take unrelated topics and we relate them to chiropractic. The deal is today's topic with DJD and DDD, degenerative joint disease and degenerative disc disease. I'm telling you, Scott, people think they've gotten a death sentence. And I'm telling you, if any one of you are listening to me today and you've gotten a piece of paper like this from the hospital because you had an MRI or you had a CAT scan or you had plain film x-ray and it had degenerative disc disease or degenerative joint disease, the doctors act as if there's nothing you can do. You're just going to have to live with it, and you're going to have to be put on some type of NSAID or some type of medication. Right. You need rehab. You possibly are so far gone you have to have surgery. Right. And so it's like getting a death sentence. And Scott, I'm in the office. You said, what topic we would talk about this week? I said, my goodness, last week you couldn't believe how many people I said, oh, I got the degenerative arthritis, and my doctor said I can't get adjusted. I can't do anything. So they have basically been told, they need to go home
and just live in pain.
Sit there, do nothing, and live in pain. And I'm going to tell you this right now. I'm putting my foot down and said that's the opposite of what you should do.
You need to be doing.
Yeah, because joint disease, arthritis, sets in because of a lack of mobility or proper mobility of a joint. So here, we'd like to start with a few stats. How many people are plagued with DDD, degenerative disc disease, seen on plain film? Blow your mind. 27.3% of the United States population have plain film x-ray degenerative joint disease or degenerative disc disease as seen on film, Scott. Wow. So it's not made up. It's actually, you can see it on film. What does that mean? That means they're starting to see joint spaces, the disc that should be this big is starting to decrease.
Okay.
They're not uniform throughout the spine, right? They're also starting to see bone spurs, what they call it cortical outlining. So you start seeing a white harsh line around the bones of your spine. This indicates that the area is in trouble.
Okay.
So I've had so many conversations this past week with patients, and if you're listening to this, I hope you get it, that it's not a death sentence, but we do need to do something because your body is saying, okay, check engine light. On the x-ray is like, okay, this area is in trauma, this area is in trouble, it needs help, all right? Let's do something about it, because if we don't do something about it, your body does step in, because we're self-healing, self-regulating organisms, it starts laying down more bone cement. So what's going to try to do is that disc starts to dehydrate, and it's going to start to build a bridge from the bone above to the bone below. That's why you get these big honking bone spurs, and they start growing together to create a almost like pillar.
Is it a support?
It's a support.
So I'm actually sitting here because I don't know a lot about this. So I got really excited about this topic because I want to know this. So I was going to ask you, as you were explaining it, it is when that disc starts to deteriorate.
Yes.
So they're getting closer together. So as a defense mechanism,
your body will start growing legs
it's like
out.
we've got to protect it from touching bone to bone per se. So it starts building a pillar or some kind of brace, something
called, and they're called bone spurs. You've seen this. You'll see degenerative arthritis and bone spurs.
See, you think of bone spur, I think of a spur. I think it's something like this little pointy thing that gets on there. And
it's pointy, and they hurt.
But it is. But
your body's laying down cement. It's laying. I like the word you said. It's laying down a support from the bone below and the bone above, and that's what we see all the time. So we see people in phase 1 a lot. We see people in phase 2, phase 3. If somebody's in phase 4, the only thing that's going to help them is hopefully they don't have pain. If they do have pain, surgery at that time option is not even an option on the table. So we want to catch people in pre-degenerative arthritis or in phase 1. Right? And we want to catch them, especially that's why we see a lot of children in the office, why we see a lot of athletes, young athletes, because I'm going to get into this. What brings degenerative arthritis? What causes this 27.3% prevalence rate in the population? I mean, they did a poll. 40 million people annually are not prescribed, are diagnosed with arthritis. What is arthritis? That just means joint inflammation. That means that area is screaming for help, Scott. It's got an issue. The joint might not be articulating properly. It could be subluxated. It could be dislocated.
So that, I was about to say, it could be subluxated.
100%. And all joints can get subluxated. Because all subluxated means it moves within a few millimeters out of place. A dislocation means it like moves out of place and now you have no range of motion. A subluxation can exist and the bone and the joint still move, but have pain, have abnormal friction, and it does create an abnormal acceleration of degenerative joint disease of your spine, if we're specifically talking about these bones. So if you've had, like I have here, what causes accelerated DGD? Trauma.
Right.
And you hear about this all the time. Like car accident, slips, falls, bumps, bruises. And it starts when we're kids. Sports, I'm telling you, that was my next one. Athletics. You know, I had a kid in here the other day. He's got a spine of about a 35-year-old because he's been banging helmets since he was like this big in the Pee Wee leagues. They call them little mushroom heads, right?
As we were talking about this topic, I said that to you. It's like, you know, I'm so excited to learn more about this because I have been told this since I was a young age. Motorcycles, sports, you name it.
Sports, job. I mean, I personally did not know that I, as a doctor, looking down all the time at patients on the table was going to be a detriment to my health. 10 years goes by, I started having mild headaches, Scott. What's going on there? I've never had headaches before. You know, I was a wrestler, got my head racked around, didn't know. Next thing I know, 10 years ago, I had this x-ray. Now play it forward 10 years, my x-rays look completely different. I was in phase 1 degenerative arthritis. I had lost the curve of my neck. And I hope you are all listening to this, understand that it just happens to even the best of us. I live in the chiropractic profession and these things can slip in.
So just the repetitive motion of looking at the table.
All I'm doing is I'm training my muscles, ligaments, and tendons to be in this position, which is the abnormal position. I should be up like this. Now, that doesn't mean I walk like this because my body accommodates. How it does it is it starts stretching the curve out in your neck. So I should have this curve. I went past the military neck and I started going the opposite way.
Wow.
And so what that does is that starts loading the lower part of my spine in my neck where I'm having my problem even just today. And I've had early onset degenerative arthritic changes 10 years ago.
Geez, so is that like, one of the big phrases now is that tech neck or text neck?
Oh, text neck is a big thing. Because you're looking, and I'm looking down at patients. I do look at my phone. But the biggest thing we're seeing prevalence with kids and this degenerative arthritic changes are happening because they lose that curve in their neck. They are losing structural integrity in their neck. Now they're having abnormal wear and tear on their lower part of their spine. Think about your car. If it's out of alignment, the tires aren't just going to last long. And in our spine, we can't just pull parts out and put new parts in, like new tires.
Unfortunately.
Right, we have to get it aligned. So we see a lot of kids in here that I'm telling you, it's a battle.
So that is text neck is basically by getting the abnormal
goes the opposite
curve.
way.
So it gets so basically they are getting DDD or degenerative.
They're having early onset degenerative arthritic changes in their spine, and you can see it on X-ray. So this goes into in kids.
Yes, I mean, this is really young. So we talk about text neck and this stuff.
100%.
And we may do a topic on this moving forward because this is outrageous.
Yes.
The tech neck
Yes.
and text neck with phones, and then just workplace ergonomics, computers.
Well, that's
all
what I was
that
saying.
stuff.
Workplace ergonomics, I mean, that's what I was using myself as an example. Somebody pulling on a lever all the time, they're going to start creating some type of scoliotic behavior because they're overusing the right side. The spine's going to move. And then what happens, now you have bones that are not in their aberrant position. They're in abnormal position. And they are, I'm going to say, working against each other, creating abnormal friction. Boom. Now you have arthritis. 40 million people a year are diagnosed with new arthritic cases. And then if arthritis is in there long enough, you're going to have early onset degenerative arthritic changes, which means your body is going to start throwing scar tissue that then grows into these pillars on the front and back. Now, what's bad about that is once those pillars set in, they're bone, baby. They don't move. So we have to work around it. And often people that have gotten that far have already had surgery, where they suck the disc out, they put in a bone graft, they fuse the bones together, and then they put a plate and screws.
But basically, that just fuses, that just ceases to move.
Yes, because what happens is that disc comes down too much, and you get too much degenerative arthritis. The nerves that are coming out from the spinal cord, we talk about this all the time. Your brain sits up here, then there's a spinal cord, then you have 24 sets of spinal nerves that come out the sides between the bones. When that disc starts to dehydrate, that it's going to start collapsing the intervertebral foramina, IVF, where the nerve comes out, and it's going to start crushing the nerve. So you better believe it's a surgical event if it starts crushing down too much. You got to go in there, pump that space up, keep those nerves flowing so they're telling your heart, your lungs, your whatever part of the body they're running to what to do and how to do it and when to do it. Yes. So degenerative arthritis, I mean, my biggest thing is if you've been diagnosed with it, which we all have, okay? And it's been seen on x-ray, it's not a death sentence. What you need to do is, and I have some things here, okay? Most Americans are dealing with traumatic stress. They all have stressful jobs. You're probably an athlete. Childhood athletics right now, I mean, even my kids that were swimmers, I was trying to keep them away from this stuff, and they have stuff because they do flip turns. So they're always creating that same moment. Well, what happens, Scott? Just like me looking down, now they have little curves in their spine that we are now moving back to where it should be stick straight. All right. What do? Action. You got to stay active. You have got to stretch. The last thing you need to do is get a DJD or a DDD diagnosis and go sit on the couch and do nothing. You want really quick onset of degenerative arthritis? Do that.
But now you were saying that is typically the more or less the remedy.
Because they're usually in pain. So it's like, well, how do you deal with pain? Don't move.
Don't move. Take some kind of
pain like NSAID, anti-inflammatory, muscle relaxer, painkiller, which has kind of already put us in this opioid epidemic, and I've gotten emotional about this already before. But we've got to remove. I'm not saying those things are not needed if you're in that level of pain, but you've got to be doing things to move you outside. So staying active, getting stretched out, going to lifting weights. I remember one of our mentors said he was on prednisone. Prednisone, massive steroid, will get you to gain weight. It doesn't make you feel great, but it can help reduce inflammation, which then reduces pain, but you feel like crap, okay? I'm prednisone for years, and you can't just go off prednisone. It's a death sentence. You just try to go off it, you go crazy. You could almost die from it. So what they did is they found out that a trainer was working with him and said, dude, are you lifting weights? He's like, no, I've been told I can't do anything. I was told not to use my joints. And the trainer's like, I'm going to challenge you. We're going to start weight training. Like weight, not heavy weight. We're going to start weight training. We're going to see how you feel in 6 months. Boom. Off the prednisone. All of his joint pain went away. Still has arthritis because once it's there, it's there.
It's there.
But he was able to start moving by getting active and getting up to it. And not sitting on a couch waiting for this arthritis and DJD to miraculously go away. Because there's one thing I can guarantee everybody on this Crack Talk is it only gets worse. It's like balding tires. If you keep driving on them, they only get worse.
It's like, the balding tire every day. If you have a bald tire, you want to go out there and the tread be back. It's like, can it please?
You can wish as much as you want. Tread's not coming back.
Can it please just go away and the tread be there?
Or just pray for no rain or snow so you can glide on the road.
Then there's that. One way or the other.
Pick your poison. The other thing is hydration. I cannot tell you how many people are dehydrated here. And if you're drinking pop and all this stuff, that's
Awful.
not hydrating.
Yeah.
That's not hydrating. You have got to actually put water in your body. Seltzer waters are good. I mean, just fluids in your body so that your joints can get the fluid in, which helps, that hydration helps picks up that inflammation in your joints and helps get it out.
So basically, is that like you're lubricating your joints?
Lubricating your
joints.
joints.
To keep the fluids in that water.
Yep.
Keep moving, keep watering, keep those joints lubricated.
And when we're talking about spine, we're talking about the spine, I think the disc is 90 to 95% water.
Wow.
So you think about this, if you go dehydration too long and you're not taking care of yourself, you're not stretching, you're not hydrated, you're not staying active, it's not going to take long for these discs to be noticeably squished on film and for your body to then start trying to build
when you dehydrate something, I always say, well, first thing that popped in my brain was the sponge on your sink that you use. When you're scrubbing with it, that thing's full and fat, full of water.
Yep.
You come back the
Nice
next
and
morning.
squishy.
Yeah, you come back the next morning, guess what? It is hard and thin.
Exactly what happens to your disc. And when they get hard and thin, they can herniate really easy. They can bust out to the back, which you can start getting sciatica, and we talked about that, low back pain. I mean, these things can get very, very serious very, very quick. Now you're behind the bus, you're trying to rehydrate the sponge or you're trying to rehydrate the disc. It is possible. And that's one of the reasons we wanted to do this today is people given this death sentence to go sit and do nothing. It's the opposite. You need to stay active, you got to get hydrated, and you got to also work on ergonomics. In your workspace, in your home. Sleeping is one of the biggest ones. Be back in the clinic, adjusting spines. I constantly have to watch and pay attention. You've heard me talk about this. Watch my back because I do have a bad L5 disc from childhood athletics and not taking care of myself. So I'm preaching to the choir here, man. I'm making sure I'm looking in the mirror. And it's probably why I'm a little passionate about this because it doesn't go away.
Well, I'm getting fired up on this just because, like you said just a second ago, staying active. How many people are sitting home watching a TV or their computer drinking toxins, be it soda or coffee or whatever, sitting around all day?
Hey, don't talk about that coffee.
Doing nothing. And then it just...
But they've been told to do nothing.
Yes.
I'm telling you, you go to your general practitioner and you have that kind of arthritis. It's kind of like old school. Back in old school, they if you broke a joint or if you dislocated a joint or you broke a bone or you tore a muscle, the first thing they did, Scott, was tell you to just go home and rest. They don't do that anymore. They only let you rest for about 3 to 4 days because they know that your body's going to start laying down scar tissue. So now that's why PT, physical therapy, has gotten so aggressive. And orthopedic surgeons like, okay, you're going to get about a week off post-surgery, and then you've got to be in the office. You've got to be in the PT office, and you've got to start getting... That's why they have walking cast. I mean, they've changed the whole game has changed because understanding the physiology of the body is if you go into static, which means you go stalemate, no movement, your body's just going to start laying down scar tissue, and if that joint's not moving, it's going to lock the joint up.
This is making me think of the worst thing you can do, when you think about a car or a home or anything like that, is let it do nothing. Just set a car out and let it sit there.
Well, think about this. What's the worst case scenario for a house or a car? They don't get used.
Don't get used. Sit and do nothing.
They'll rot.
They'll go static.
They'll rot from the inside out.
Yeah, they will. It seems like it will go faster than if you live there daily and live in a house or drive a car.
Even if you're beating it up a little bit, it stays, it thrives. Yes.
Yeah.
That's a great analogy. Thank you, Scott, right there on that one. A house or car. So your discs are the same way. Your joints are the same way. So I tell, I've been diagnosed with osteoporosis, which is brittle bones. Number one way to prevent that, go out and exercise. That's why you got mall walkers. You don't have to be out in this 90 to 100 degree heat. You go to the mall, they got the great AC there, and you walk around and you start loading that joint. It's called Wolff's Law. Wolff's Law says when a bone is stressed, it will lay down more bone. So what happens, that's how you prevent osteoporosis, which is a whole nother condition, but we'll talk about that another. And the last one, get your spine checked, which is what we talk about. Find a chiropractor in your area. Get your spine x-rayed. Get it examined by a competent chiropractor that you get a referral from one of your friends or family member that says, hey, I went to this guy, he does great, or gal does great. Go there. Get your spine checked. Do a full consult, orthoneuro test, and have x-rays taken, and have the doctor show you what is happening on. Because I'm going to tell you this, one thing we do in our office, and this is kind of commonplace, is we don't do what normal people do. We don't just print out a sheet of paper and say, okay, here's your x-ray report. We actually put them up on a big screen and say, This is what is going on. And our scripting is, I want you to leave today, Scott, with an exact image of what's going on with your spine, because I think each and every one of us that are you listening, us sitting here, the only way we can take our health back and actually do something about it is if we have a clear picture of what is happening and then an exact plan of action to take to make it better. Agreed? Yes.
Yes.
Right. The worst thing you do is just get a piece of paper and you say, go home and sit. That's the action plan. And then you just get worse. You fall apart.
Yeah.
You become the car that's not used. You
Yeah.
become the house that becomes dilapidated because it's vacant.
Right.
No go. So you get your spine checked, and getting your spine, we've had probably 5 women this past week that came in, could barely walk.
Really?
Low back, discs, all nurses are CNAs. You hear me, nurses, CNAs?
Yes.
You guys are picking
Yes.
up people. I had one CNA tell me she works as an EMT. They picked up an 800-pound person and a 500-pound person. 3 people to pick up 500, 4 people to pick up a 800. I don't even know, and it's not a judgment. That is so, and they're dead weight. It's dead weight. And so think about the amount of pressure on this small female spine helping full out lift these. So they're hurting their backs. They've herniated. I don't need an MRI to know they herniated their disc. I could take the x-ray. I see the disc space is decreased. They have shooting pain down their leg. They can barely stand up straight. Boom, you got DJD.
Yeah.
Or DDD in our profession. And now that's a problem. What's cool is they came here, we diagnosed it, we get them under care. They have a clear vantage point. They're doing all the associated rehab that you see in the clinic here. And magically, they can't even believe it because they barely could walk. And then a week and a half to 2 weeks later, Scott, they're like, I can't even believe it. I had some hard days, but I am up about and I'm back to it. And I don't even feel the pain back there. But that also doesn't mean they're done.
Right.
We still have to get that DJD to get out of there. We got to get that arthritic condition out of there. How do we do that? Adjusting those subluxations, restoring function to the muscles, ligaments, and tendons in those areas, getting the right curves in there. Because so many people are creating scoliosis or detection, which are abnormal curves, and these accelerate degenerative arthritis. So I don't need to add anything else to this except for if you've been diagnosed with degenerative arthritis, it is not a death sentence. You could do something about it. You got to get active. You got to hydrate. You got to watch your nutrition. You need to be watching your ergonomics, living and at your job. And you need to go get under chiropractic care immediately to see your way through this thing. Because there's nobody else in the world, Scott, as a profession that is better at treating DDD and DJG than a chiropractor.
Wow. So let me ask you this before we go out of here. So thinking of degenerative disc and the neck, back, things like that.
Yeah,
but now one thing I wanted to ask you is, so arthritis, say elbow. Somebody comes in and says, I've got arthritis in my elbow. So that is one thing we talked about in a podcast before, is chiropractors can adjust
all the
wrist. So when we were talking about carpal tunnel, doing the wrist, the elbow, the shoulder, and then looking at the neck. So just because it may be something that is diagnosed somewhere in the body, be it a knee, hip, ankle, things like that.
I blow your mind the amount of people that have come in here that have been diagnosed with, meniscal tear of the knee. It's really a calf pull. They're getting set up for arthroscopic surgery.
Really?
Like they're going to scope it. It's not. It presents as a meniscal tear. And you see these things enough. This is why getting a good recommendation on a tenured chiropractor is important, because they've seen some things. It's almost like that, is it State Farm or Allstate? We've seen some things, right? I've seen some things, so I kind of know where to go. Now, if it is a meniscal tear and I rule out it's a calf, a gastroc, or a soleus injury, then, we move on. Right. You might need to get scoped, because getting that meniscus, clipped out of there might be the right opportunity. But I'm telling you, more times than not, elbow tendonitis, you need to get, we dry needle the tendon, we do some muscle stripping, we also adjust the elbow, because arthritis sets in the joint because the joint is not functioning at what I would say 100%.
Right, not optimum level.
Yes, it's not aligned, and it needs to be set. Same thing when we talked about the carpal tunnel. Same thing with the shoulder. So finding a good chiropractor that knows how to adjust not just the spine, your shoulders, your elbows, your wrist, your hands, your hips, your knees, your ankles.
So that is a key point. I want everybody to get this, is your joints, you think of the spine being in alignment. So,
Yes.
You've got the curve and you want those joints
Easy
stay
to
on.
understand,
Very
yes.
easy to understand. Joints need to be in alignment too.
100%, or they're not functioning properly, and
Which
you have
then-
early onset arthritis,
Yes.
or degenerative arthritis, worse. And once degenerative arthritis sets up, I'm telling you, the amount of work it takes to reel it back is pretty intense, because your body doesn't like to pull back scar tissue that it's laid down.
No, well, it's just like you pour concrete. I don't want to take it up. It's hard to take.
Great
up.
analogy. Great analogy. It's too heavy. It's a lot of work.
Well, you got to bust it up. It is a mess. I don't want to deal with it. You know what? We'll just leave it there.
Yeah, so I'm going to tell you, your body operates in the kind of the same form we would as humans. We don't want to do extra heavy work.
I got to get
but
the jackhammer out.
we want this. A jackhammer would be surgery in this case right here. So degenerative arthritis is not a death sentence. If you have been diagnosed this with, like myself, like Scott, there is hope. I hope you got a lot out of the education piece today. I hope you got inspired that you don't have to live in this type of pain and discomfort, that hopefully a chiropractor near you can help move you from where you're at, and your life is in the balance. And I'm telling you, I see people, they've given up. These nurses are already thinking, okay, I got to give up my job. I had a guy the other day that says, I don't know if I'm going to be able to work in the factory anymore, because his back was so bad. And now he's like, oh, pain's gone.
Over the last week, I had a family member in the hospital.
Yes.
And we've been in the hospital, and now we are in a rehabilitation facility.
Yeah.
And 3 nurses I have talked to, same story, and I'm sharing information, wanting them to come in and visit you to get checked out, do the consult and exam and all that, to get some x-rays, because they're beat up. And I mean, these are young people that, are just, they saw me wearing my chiropractic shirt, says, you a chiropractor? And I'm like, hey, let's get you in here.
Man.
And then they start telling me, low back, this, that, these things hurting.
A nurse's life, a CNA's life, an ENT's life. I could play the tiny violin for all the professions I see. If you were the athlete, you're beating yourself up, which creates early onset. If you're doing nothing about it, here's the biggest thing. The thing that you should need to take from today: action steps. Hydrate, stay active, work your muscles, ligaments, and tendons, right? All right? Get your nutrition on, and get into the chiropractic office.
100%.
All right? And if you're scared of the chiropractor, at least go to a chiropractor and let them walk you through what's possible. Because I have had a couple people, they're always scared of getting their neck adjusted or scared of the snap, crackle, pop. And we did a podcast on that one. Go back, I think, What's That Pops? I think it was our first one ever.
We did that in the side effects of chiropractic.
It's good to just know. And you come to a chiropractor like me, I'm going to brew confidence into you, because I do this day in and day out. And it's no joke to me. I know what I'm going to be able to do inside this office, getting people from where they're at, getting them inspired that they don't need to live there anymore. They can get moving, Scott.
Right.
And I just love it. That's why I do this. That's why we're doing this podcast, is to move, touch, and inspire people that you don't have to be the way you are. You can be greater, and you can hold that grandbaby.
Yes.
Right? You can go play that pickleball.
Yeah.
All right, even though there are injuries like crazy coming out of the pickleball, I think they're keeping the ERs in business right now. But you can go play golf.
Go back, get back, and do the things you love to do.
Whatever it is, you can paint, you can kayak, whatever. I feel blessed every time, Scott, somebody comes in and they said, I did not know this was going to help me as much as it did. That's the greatest compliment I can hear. And I was just part of that story. I'm not your body that heals, because our bodies are self-healing, self-regulating machines. And I believe in that. So my job is just to kind of get in there as a chiropractor and get things moving and put back where they need to be and help facilitate the body's healing process. And you do that, miracles happen. And I would want that for each and every one of you that are listening. I want it for myself. I want it for Scott. All right, so there's our crack talk today. DJD, DDD, not a death sentence.
Not a death
all right,
sentence.
Scott?
I love it.
So take it back. What are we going to do?
All right, so I'll remind everybody, if you like what we're laying down, please subscribe to this channel. If this topic relates to you, or if you know somebody that is dealing with painful arthritis, DDD, DJD.
If you know somebody that's one of the 27.3% of the population, or one of the 40 million people that are diagnosed annually with arthritis,
send it, share it, please share it, like it, send us a comment, and let us know what you think of CrackTalk.
All right, there it is. Thank you for being back at CrackTalk. We'll see you next week.
See you next time.
Bye, guys.